today with Tiffin Anatomy Society in coordination with MedicAid-UK, I'll be doing a sheep eye dissection. So if we come down, we can get started. To begin with, we have the sheep's eye here, and when it comes to the anatomy of the sheep's eye, we're going to actually look at a layer you can't even see with your eyes because it's 1 cell thick, and it's the conjunctiva just over the top of the cornea, which is a separate part which I'll go into in a minute. And the conjunctiva here is the bit that gets infected and inflamed when someone has conjunctivitis, or more commonly known as pink eye. The next bit we're going to look at is the cornea. And the cornea here is actually meant to be crystal clear, glass clear. But in this case you can see it's all cloudy, and that's because the preservatives used to preserve this sheep's eye has denatured the proteins inside the cornea. And now we can look around the eye, and here you can see all this fatty tissue, this brown stuff, and this is commonly known as periorbital tissue, meaning around the eye tissue. And it consists of connective tissue, fat, and these are all important for shock absorption because they're very delicate and very sophisticated internal parts of the eye which need to be protected, and the fat acts as a really good shock absorber. And if we go to the back of the eye, we can see here this structure, which is the optic nerve. It's been cut off, but you can see it's coming out around the back of the eye. This is the optic nerve, and it goes directly to the occipital lobe at the back of the cerebrum in the brain. And then just around the eye, you can see this brown tissue all around it. And most of it's been cut off, for example here, but that's actually muscle used to make movements with the eye. That's why you can keep your head still and move your eyes round. So now what I'm going to do is just remove some of that periorbital tissue, and then we can get started with internal cutting. So for example, this little bit here needs to be cut off. Be quite delicate with it. This is all just fatty tissue, as I said earlier. And then we get a better feel of what the eye actually looks like with this fat removed. Alright, the next bit is that we're going to actually go into the eye. We're going to go into the sclera. We're going to penetrate the sclera and go into the cavities within the eye. But the sclera is quite a difficult and very hard material made out of fibrous tissue. So you can't just use your scalpel and do this. You need to hold it in a special way where you make sure when you put pressure into it, it's not going to slip past like that. So you're going to hold it here and here. And just posterior of the cornea here, this cloudy structure, just posterior, so we don't actually hit any organs, internal structures, just posterior at the brown bit, we're going to make a cut. And that little splash was the internal liquid within the eye, which are known as humours. There's 2 types of humours. At the front, we have aqueous humour, which is very watery, and the other type of humour, which is more jelly-like and actually helps retaining a solid structure, is known as vitreous humour, which is, as I said, more like jelly. So just posterior, we're going to keep cutting, and as you can see, the liquid is going to keep coming out. So the way I said, to keep cutting, all that liquid is aqueous humour. And as I said, it's quite difficult to cut into the sclera because it's made out of a fibrous sort of structure. Okay, put the scalpel away. And here we have the 2 halves of the eye. As you can see, I didn't actually disturb any of the structures, which is quite important. Here we have the anterior half of the eye, which is known as the anterior 1/6. Then we have the posterior part of the eye, which is known as the posterior 5/6. And all this liquid, as I said, is aqueous humour. But in here we have a little bit of jelly, which is known as vitreous humour. And that vitreous humour is really important because it actually acts as a method of pushing against the sclera, the wall of the eye, and giving it rigidity and support. I'm going to move the anterior to the side for a moment, and we'll start with the posterior part of the eye. Okay, and the first structure that we're going to look at when it comes to the posterior 5/6 of the eye is this little film here. And you might be thinking, well, it looks a bit cream, and it's actually the retina. This is the retina, and it's the all-important part of the eye which detects light. And it's actually kind of like miraculous how it works, because it converts a physical waveform, which is light, into an electromagnetic impulse that can be interpreted by the brain. And it's pressed against the inside of the eye by the vitreous humour. And as you can see, it's all connected at one point here. So now, here we have the retina. As you can see, it's this cream sort of film that is actually pushed up against the sides of the eye by the vitreous humour that I was talking about a couple of minutes ago. And you can see all of this cream film, known as the retina, is the most important part of the eye because it converts the physical wave that is a light wave into an electromagnetic impulse. An electromagnetic impulse and sent directly to the brain. Right. And as you can see, all comes up to one point. All of this is against and pushed up against and converges at one point. This little round sort of thing here, which is the optic disc. And if you look directly posterior of that, when I flip the eye around, you can see we have the aforesaid optic nerve, which I mentioned earlier. So all of these photoreceptors convert into those axons into the optic nerve, and they become the optic nerve as you go through the sclera of the eye. And a little fun fact is that animals which are nocturnal or corpuscular, animals which feed at twilight or dusk, they actually have a sort of metallic and iridescent layer just underneath the retina, which reflects the light twice. That's why sometimes when you see cats at night and shine lights into their eyes, it's all shiny. It reflects back as shiny, because they actually have a bit of metallic sort of shine in their eyes. So they can actually have better night vision than us humans, and in this case, sheep. So if I just push away the retina, just very gently, you can see it all converges onto this one point where it's fixed here, the optic disc, your blind spot where you can't see, which goes directly to the optic nerve, which I just mentioned a minute ago. But then, what's this black layer? And this black layer is actually called the choroid, and it's extremely vascular rich. There's a lot of blood vessels which directly supply the retina. If we pull back the choroid, we have the sclera, which has been slightly dyed by the black pigment within the choroid, but this is the sclera. If you look carefully, when I squeeze, it goes straight back to its original form, which suggests it's made out of a fibrous material, and it's very important for the eye to retain that round, almost spherical shape, and hence allows light to be consistently refracted and transmitted at a consistent angle. Right now, I'm going to move this, and we're done with the posterior 5/6. We're going to go to the anterior 1/6 of the eye. So, like before, I'm just going to pour out the excess aqueous humour and some vitreous humour, which is not really that present at the moment. And what is this gumballed round shape in the middle? Here in the anterior 1/6 is called the lens. And the lens is normally clear, as I said, crystal clear, like the cornea, but unfortunately the preservatives have denatured the proteins within the lens. The point of the lens is to refract light so that it can be focused up against the retina. And then, what's this? All this sort of white, cling filmy sort of material, that's called the ciliary body. And it contains this striated structure here, sort of lines going along it. Right here, very clear, you can see these striations going straight across it. That's actually suspensory ligaments, which directly attach to the lens. And against here you'd have your ciliary muscles, which would pull against those ligaments and change the shape of the lens, hence affecting where the focus point is against the retina. So, if I just slowly lift up the lens, it'll perhaps better show you. And you can see just there, just at the tip of my needle, there, you can see it's attached to the lens. Those suspensory ligaments, that ciliary body, is directly attached to the lens. If I lift up a little bit more. And it just looks like cling film, correct? Okay, now I'm just going to remove this very gently. This gumball structure, which normally would be very, very soft. This would be really soft, of course, because it needs to be moved and reshaped a lot of the time to reflect light. Let's move that to the side. And in here, we have the iris, just medial to the ciliary body. And this controls the aperture, the size of this hole within the eye. So when it comes to this hole here is called the pupil. And is effectively the aperture. The aperture of the camera is how big the hole is that allows light. Aperture here that allows light into the eye is called the pupil. And here we have the iris. The iris is the body that controls the size of the pupil. So during the day, the size of the pupil will decrease because there's a lot of light, and during the night, the size of the iris, the size of the pupil will increase to allow more light in because there's of course a deficiency of. Okay, so I've just described to you the iris and the pupil, and that is it, pretty much it when it comes to the eye. So thank you very much for watching, and please tune in to the next episode where I come and do another dissection for MedicAid and Tiffin Anatomy Society.